Have you ever wondered how physical therapy works and whether or not it can help you? Well, my name is Elizabeth Wergen. I'm a doctor of physical therapy and owner of Juniper Physical Therapy in Manitowoc, Wisconsin. And I get this question all the time. Well, I think the reason for the questions is because there's a huge variety of differences between one physical therapist and another, as well as one setting and another. And this makes sense because as physical therapists, we are trained to treat a wide variety of people, ages, conditions, and we also work in a wide variety of settings. In addition to that, we have the opportunity to take a ton of different continuing education courses that teach us all different types of techniques. So I'm going to do my best to explain to you how it is that physical therapy at Juniper Physical Therapy works, so that if you are trying to make the decision as to whether or not you want to come in, you can hear what I have to say and see if it's something that makes sense to you. So at Juniper, we're going to start by listening to your story and hearing how your symptoms came to be. That story is really important and gives us clues to figure out how your injury or your pain may have started. We're going to touch where you hurt to feel the tension in the tissue, how taut it feels, how well it moves or doesn't move, and how tender it is. Then we take a look at how well your body moves as a whole, because everything is connected, right? Once we find some discrepancies in how your body moves, we're going to go a little bit deeper and take some more details in the individual joints, muscles, or tissues and figure out exactly what's going on. So the way that physical therapy works is if your body is in pain or you have some sort of symptom, there's a reason for that, and we're going to discover that underlying cause. Now, it's simpler to determine that cause if you've been injured, right? But if you haven't and your pain just came on and you don't really know why, that takes a little bit more investigating. So the way that your body moves is crucial to determine how well it's working and how it feels. So as we go through our mobility screens, we're looking globally, like as I said, as to how well it moves, and we're pairing it up to what an optimal movement pattern would look like. Then we move into those areas of your body that aren't moving really well, and we try to figure out, is this a mobility problem? Is it a flexibility problem? Is it a strength issue? Or is it a stability issue? And we can figure that out. So that's how it works, is we figure out how well or not well does your body move and relate that to where your symptoms are. So then physical therapy is something that is done to you, but then also our goal is to educate you on how your body moves well or not, and then teach you how to take care of it. So the things that we do that are more passive, we use our hands and a wide variety of tools to help reduce your pain. So our first goal is to get your pain to come down and reduce that. When you feel less pain, you can move better, right? Then our next goal is to restore your system, is to make sure that we get all those movement patterns to improve them and get you closer to moving optimally. As we're going through that phase of care, your pain should still be reducing down. Once your pain is down or almost gone and you're moving better, then we want to make you resilient. We want to get you stronger in that good movement pattern so that you can do all the activities that you love without your pain returning. Now, the way that we do this as well is that we are looking for people who are motivated, who want to take the time to get to know their body and to learn how to self-treat it. You're going to be receiving a home exercise program that's going to include self-care and exercise. So by self-care, what I mean by that is I'm going to be teaching you how to use different tools like foam rollers or mobility balls or even just your hands to treat the tissues that are tight or taut or don't have as much movement. And then you're also going to be receiving prescriptive exercises to stabilize and strengthen the areas that aren't as strong. This requires work. So I want you guys to know that when you start a physical therapy plan of care, you're committing to taking care of yourself. So it's a combination of what we do to you, what we teach you, and how you help yourself. So if this sounds like something that you're interested in, by all means contact us and come on in. But you know what, if you're somebody that are looking for more of a passive treatment, where you just want to lay down and you want someone to take care of you, you'll get a little bit of that here, but that's not going to be the primary focus of our care. So I just wanted to put that out there, just so you can make an informed decision as to whether or not physical therapy is right for you. So if you have any questions at all, feel free to contact me and I'd be happy to talk to you about it and do my best to answer them for you. Okay, hope that helps. Thanks. Bye.